So before we talk about vaccines, I would like to spend some time level setting the conversation related to our community transmission levels, where we stand right now. Unfortunately, this topic has not received what I think is adequate and appropriate attention, and certainly received the necessary explanation from the state in terms of shaping the conversation about where numbers are moving forward and what seems to be the basis of those recent changes. So when we look at, again, our transmission levels here in Montgomery County, we're sitting right now, our 7-day average is approximately 11 cases per 100,000 residents. And again, when you look at that, it is above the high transmission categorization based upon CDC classification. And this is higher than where we were last summer. And it's important to note, again, for points of comparison, we've been presenting this in our weekly press briefings, but I don't know if we've been able to present it in these discussions. But this is where, when looking at test positivity, where we were on March 8th, when the governor made his determination to open up the state in terms of rapid reopening. And none of the counties, with the exception of Charles County, were over 5% at that time, and Montgomery County was at 2.73%. Here's where we currently stand right now. The state average is just shy of 6, and we have a number of counties that are now over 5%. In fact, when I counted this morning, Montgomery County's test positivity was 20th in the state compared to our other jurisdictions. And the chart on the left here shows where the county test positivity stand. And Montgomery County, you will see here at 3.3%. This was earlier this week. Now it's up at 3.4. And this is important to emphasize, is that test positivity has increased. We are seeing, unfortunately, less people getting tested. And so we speculate that there may be a hidden trove of asymptomatic individuals who have not been tested, as well as symptomatic individuals who may, given that this is also allergy season and pollen season, may be experiencing symptoms and not getting tested due to belief that that is what the source of those symptoms are. Now, similarly, one of the other metrics that we look at is case rates per 100,000. This is, again, the map of Maryland on March 8th. Where Montgomery County was 9.3. We had no counties over 20 at that point, and no counties in the red zone, which is greater than 25 cases per 100,000. This was yesterday. When we look at the state map, again, Montgomery County, our rate sits at about 11, but we do have a number of jurisdictions who are now in the red zone, including Baltimore County, Harford County, Washington County, and a number of other jurisdictions that are knocking on the door of 20 or over 20, including Howard County, Prince George's County, Anne Arundel County there. And so these trends are concerning. In addition to the community transmission levels based upon test positivity and case rates, we have also seen an increase in hospitalizations across the state, both in terms of acute hospitalizations as well as intensive care hospitalizations. Now, we think this is, I know that some have said that I think the governor's office has recommended that the large driver of this is travel. That's just not factually true. Travel may be a component of it, but quite frankly, from an epidemiologic standpoint, we are concerned that, again, the rapid reopening has contributed to this increase in cases, in large part due to the presence of variant strains here in our community, in our region. As we've previously talked about over the last several weeks, we have seen increasing presence of those variant strains here in Montgomery County. We have seen at least there's 5 different variant strains. And I know we're trying to shift away from geography, but for the simplicity for folks at home, we've seen the UK variant, which is B117. The UK variant, or B117, is the predominant strain in Maryland right now. We think that is also a big driver of the increase in cases in the Baltimore metropolitan area. We've also seen Brazilian, the South African variant strains that have been identified as the California variant as well as the New York variant strain here. Those variant strains are more contagious than the novel strain, and we're also seeing an increase in the variant strains in younger populations, including in children, where we did not see comparable increases in those cases earlier on in the early stages of the pandemic. Now, we're happy to answer any questions related to transmission. I would like to pivot in the interest of time to give some updates in terms of our vaccination program. We have now at least 35% of our residents have received at least one dose, and we've now fully vaccinated 20% of our population in our county. Again, building on the county apparatus as well as multiple different resources that folks have been able to access. Now, you also are aware that the priority group status, we were required to shift our status to match the states. And so hence on the right side, we now have the categories broken down by how the state is classifying folks. And effective this week, those who are 16 and up with underlying medical conditions who are able to self-attest their condition in terms of meeting the criteria per state direction, are able to register and get a vaccine. I want to caution folks, however, is that when we say all of these folks are eligible, that does not necessarily mean you will get a vaccine the next day, today, or in the near future, because again, all of that is contingent upon the supply of doses that are available. Now, we obviously want everyone to get one, but at this point, while saying everyone's eligible, we're encouraging them to pre-register so that we have their information. We also want to make sure that we eventually get the number of doses to be able to cover everyone who meets the criteria. So we are continuing to await more doses being delivered from the federal government to the state to be able to be parsed out to not only support the cache of doses we have available as a health department, but to also increase the ability for private providers and other venues to also be able to access the vaccine to give increased touch points for individuals to access and get vaccinated. This breaks down the number of doses number of vaccines administered, as well as the percentage of population vaccinated. Again, you see here we have the number of vaccines for residents has been over 300,000 first doses to our residents, and we have vaccinated over 20% fully and approximately 35% of folks having received at least one dose. I know Dr. Stoddard will likely talk a little bit about this more, but want to highlight that yes, there is a mass vaccination site that will meet state or be officially a state mass vac site later this week. I would like to highlight, however, that the county apparatus stood this up and will continue to stand this up primarily and support these efforts. And so this site has gone live since last week, and we have been moving people through and getting vaccinated on a daily basis. We did have a shift this week. The majority of doses, actually nearly 98% of the doses that we received this week were Pfizer doses, which is different from the first sets of allotments that we received for multiple months being Moderna. We do anticipate that once the manufacturing issues are cleared up, that we will start to get more supply of Johnson & Johnson doses as well. And so we will continue to respond nimbly to be able to offer those different doses to folks. But special kudos to the teams that have helped stand this site up already, and we look forward to getting more resources from the state to be able to sustain this at a high volume, vaccinating well over 3,000 people on a daily basis. This just breaks down, again, the number of doses that we have been given versus those that have been administered. We have been exhausting our first dose allotments on a weekly basis now. And again, we are continuing to devise creative strategies to be able to support community partners as well, who've been trained extensively, as you all are aware, in the past week or so that they may be able to leverage these additional doses that we're getting to, again, increase contact points and places for people to access. Just another breakdown of the percentage of doses that we've received versus those administered. This breaks down by race and ethnicity, the percentage of residents covered, as well as by age. And while we have seen some improvements again in terms of getting folks in communities of color vaccinated, we still clearly see that we have some gaps and some ways to go, the percentage who vaccinated versus the percentage of the population. And similarly, again, we're looking at age breakdown for those over the age of 65. We've been able to make some progress, significant progress in terms of closing those gaps. And in particular, looking at the cumulative vaccination rate over time, again, for those over the age of 65. For example, we've made significant strides, for example, in Black residents. We had a peak gap of 20% earlier on in the vaccination phases. And that gap, for example, for Black residents has been reduced to 7%, again, for those over the age of 65. Unfortunately, it has closed more slowly for our Hispanic residents. We continue to utilize an equity framework to address those gaps, in addition to making the allocations and allotments, as well as continuing to work and continuing to identify community partners with footprints in those different communities where we think they will have significant impact in terms of being a trusted venue to hopefully encourage folks to come in and be able to access the vaccine in as low barrier and manner as possible. Geographic breakdown, again, we've got great coverage for our folks over the age of 65, and the challenge will be replicating that effort now that we get to younger populations. This is again, another geographic zip code in terms of the darker the zip code means a higher percentage of individuals who have received a first dose. And the lines represent, so for example, lines here show that 20 to 49.8% of those residents have been fully vaccinated, versus I don't believe we have any well, actually we do have one zip code where greater than 50% of their residents have actually been fully vaccinated. Excuse me, this is just our pre-registration data. We continue to encourage folks, please pre-register so that we have your information. When the MassVax site goes live as a state site on the 8th, we will be working to communicate and sharing that information with the state. So again, alleviating hopefully the need for people to register at multiple places. But again, please pre-register so that we have your information so that we can send you registration links as quickly as possible once you're deemed eligible. And just a reminder, we do continue again to look at priority tier 1 zip codes based upon the number of cases and community transmission levels in those respective jurisdictions. There has not been any significant change in those zip codes that have met the criteria for being those top 10 priority zip codes for consideration. All right. Well, that concludes the slide presentation. I will stop there. I'm happy to answer any questions, and I will turn the floor over. I don't know if Dr. Kroll is still here or Dr. Stoddard. And as always, thank you for the opportunity to be here with you.
Thank you. Dr. Stoddard?
Dr. Kroll, do you have any comments before I go?
Dr. Kroll, you still with us?
Not sure if he is. Okay, I can proceed. So, a few things I do want to. I'll actually going to show a few slides today too in a second, but I want to talk about the MassVax state first. I definitely want to acknowledge the work of the Department of Health and Human Services in getting doing the lion's share of the work to getting what the current operating site up. I also want to acknowledge the work of the Maryland Response Medical Reserve Corps in helping to staff that as well. In addition, I want to thank the support of Montgomery College, the Holy Cross Health getting us stood up, the state of Maryland for providing resources, obviously, and as well the work of other county agencies, transportation, police, providing security, flow, signage. All those things are continuing to improve as we operate the site. We had additional signage delivered yesterday. We have more signs in English and Spanish arriving on Wednesday. And obviously we want to make sure that, we're constantly tweaking and honing the function of the site. The state came out and visited us yesterday and is helping us to stand up a tent with HVAC to expand the observation area, which will allow us to increase our throughput to get to that 3,000 number that we want to get to. And so that work will actually begin today. They're covering the full cost of that, which is great. We appreciate that support. The National Guard has been tremendous in working with us. I want to recognize the work of Major Fink, and he's been direct contact with me every day, trying to make sure that they are providing the resources, including staffing, that we need to get the site, expand the site, and be able to sustain the site for a long period of time. So I want to make sure I acknowledge all those people. We did a site security walkthrough with Department of Homeland Security, FEMA, the Maryland State Police, our local police yesterday. It was very productive. They sent us a report this morning to allow us to make some improvements on sort of making sure these doors are secured and these access points are marked and all those things, and vaccine security and all those things. So we definitely appreciate that feedback as well. I think the governor will be visiting the site later this week. We're working on that with the state just to acknowledge the partnership and show the work that's been done again by all the partners on site. I did want to just share my screen briefly. So on Friday, Dr. Gales received from Dr. Klein at Johns Hopkins in Baltimore. He shared a modeling update of where hospitalizations are likely to go. I think it's important for the county council, also recognizing you're the Board of Health, to make sure that we're aware of the trends that they are seeing and some of the data as it relates to what's going on in the state of Maryland. I'm not going to go through all 32 of these slides. In fact, I'm just going to probably highlight, I think, 4 or 5. But certainly, I believe this full document has been shared with the Board of Health as well, and the county council. So a couple things I wanted to highlight, starting on slide 12. This is a breakdown of what the cases have been looking like across the state of Maryland in recent weeks, and you can read the paragraph if you're inclined to, but essentially what it says is we're continuing to see a decline in the representation of the Hispanic and Latinx communities in the cases, but we're continuing to see a more recent increase in the contribution of African Americans and Black residents to the overall number of cases. And so this has been a trend that's really since January. The Black and African American population has been on the rise. The Latino, the Latinx and Hispanic community has been slightly decreased. This is just important for demographic understanding. Now, the question also was asked is whether, how close are we to herd immunity as a concept? Not that close. Assuming 25% of people of vaccinated individuals already infected, that suggests there were approximately 2 million with some level of immunity, or approximately 34% of the state has some protection. That's likely less than half of the number that we need to get to achieve herd immunity, both through infection and vaccination. And so, while some of the protection that we are seeing in certain populations is very likely vaccine assisted, it is not obviously. We're not at the point now where we've reached any sort of herd immunity. Now, the question of the contribution of some of the reopening activities to what has happened, I think there's some really interesting data that Hopkins has pulled together on this idea. So there's a company that essentially assesses visitation of different business types, and they provide that data, and Hopkins obviously tracks that. And what we have seen is that there's a dramatic increase in the patronage of dining establishments and other retail since late February. That would correspond with the time frame that we're beginning to see these increases. That is similarly borne out when you look at mobility data. Apple actually tracks this with some of its mobile devices. We're seeing a dramatic increase in, as reopening has proceeded, we've seen a dramatic increase in mobility. There hasn't been, Google hasn't picked it up as much yet, but certainly in the Apple side they have. And obviously in looking at mobile phone data, we're seeing the same thing, which is that all of the jurisdictions are seeing this rapid increase over the last month or so in the mobility of people around our region. Obviously, more mobile people are, more interactions people have. Masking and distancing aren't perfect protections. And so the more interaction you have between people, the more opportunities you will have for COVID-19 to spread. And it doesn't surprise anyone that we would see an increase. The last thing I do want to show is their modeling data, which I think is sort of I don't want to bury the lead here, but essentially what they're saying is, what Hopkins has said, the models are saying is, it really depends on what the contribution of the variants are. And so if the contribution of the variants is low to moderate, as they're shown here in this 10%, 20%, 30% slides, if that's the percentage of cases that are coming from variants, then we are likely to see an increase in hospitalization, but not necessarily a third, fourth real big peak. It's not quite as big as the spring of last year or the over the winter this year peaks. However, if you start to see the contribution of the variants to be higher, obviously that will potentially drive hospitalization higher. Now, I think it's key to understand when we look at these numbers, and it's just, 3,000, our hospital capacity is significantly higher than 3,000. So we're not talking about necessarily filling up our hospitals per se, and I don't think that is what we're ultimately concerned about with this third wave, but there are a lot of people, there's a lot of suffering under each of these bumps, right? There's a lot of people going to the hospital. There's a lot of people who would have long hauler COVID symptoms likely, who may have other medical complications that are beyond just hospitalization and death. And so I think it's really important that we understand that we're not talking about necessarily causing the level of hospital surge that we've been concerned about shutting down the hospitals, but these are all people underneath this curve. It's not just a graphic that we like to show. So I wanted to give that's just that quick background on what the modeling is telling us from Johns Hopkins. There is an increase that is certainly tied to an increase in mobility and traffic as people are moving about our communities more through the spring and with the reopening activities. But how much that ends up mattering depends in significant part how quickly these variants spread and how quickly we vaccinate. This is the illustration of the race that we're talking about. In these later slides, we're not doing so well in the race. In the earlier slides where we have vaccination, and keep the variants lower, we do better. And so I think that's what it all comes back down to. We're hoping that we can get as many people vaccinated as possible while not having huge spread in the interim, and that's everyone's goal. I'll stop there.
Thank you. Dr. Kroll, anybody else? Okay. Let me thank all of you for telling the uncomfortable truth a couple weeks ago about the likely effects of the governor's mandated reopening, despite his promise to, quote, follow the science. You all correctly predicted a rise in case rates and hospitalizations over the subsequent 2 weeks. And if anyone didn't see it, I'd call your attention to the editorial page of the Washington Post on April 3rd, which pointed out that we've seen that rise in cases, largely due to the reopening, the quote, reopening, and other factors that are propelling the case count in the wrong direction. So you might want to take a look at that if you haven't. Councilmember Navarro.
Thank you, Mr. President, and thank you to the team again, and happy Public Health Week. Very well-deserved proclamation presented by Chairman Albornoz. Thank you very much for everything that you continue to do. So just a couple of observations and questions. Dr. Gales, can you clarify, I know that when you were presenting, you spoke about where we are in the county vis-a-vis the age group. You did say 16 and over with underlying medical conditions. And of course, the state has announced that now basically anybody 16 and over has access. Can you clarify that? So is it that are we in a different phase because of the vaccinations that we have, or is the state also referring to 16 and up? 16 and up with underlying medical conditions.
Councilmember Navarro. So our schedule matches the state schedule. So if I misspoke, what I would encourage folks to do is we've been directed and required by MDH to follow the state schedule. So however the state defines who's eligible is technically who's eligible. But again, I want to remind folks is that just because you're eligible doesn't mean we have enough shots for everybody who's eligible to get it right away.
Exactly. Thank you so much. Also, I noted in your presentation the slide that had the map of the folks who had been vaccinated. I think it was shade of blue. The darker the blue, the more people that have been vaccinated. And I did notice that on the zip codes of 2090204, I think '06 were lighter blue, meaning that there were less people vaccinated. Was that correct? I think you're muted.
Sorry, I'm trying to pull it up. And I didn't realize I was also muted at the same time. If I'm allowed to share my screen again, thank you.
That'd be great.
I think here's the chart that you were referencing.
Yes.
And
Correct.
so, yes, so you mentioned 20906.
20902, I believe 20904.
Yeah.
Seem to be in that group of zip codes that we have also identified as having the higher number of cases, right?
Yes.
Okay.
So here's the priority zip
there we
codes
go.
who've been hit hardest, and then compare that to here's the cumulative number of those who've been vaccinated.
So yes, so that stood out for me because, of course, we had tried to be a lot more strategic with how we would prioritize addressing those particular zip codes, and the state did basically note that we needed to follow what they were doing, et cetera. But there is no doubt that we have more work to do, particularly with this issue of equity, as it was also illustrated by Dr. Stoddard, talking about specifically our Black population, we see an uptick in hospitalizations. And so I do, believe that we have got to continue to be very aggressive in those particular zip codes, really strengthen whatever and however, fashion we can. I know that now as vaccines are becoming more available, it would be super important as we continue to discuss this issue of equity, to figure out then, what are going to be those particular interventions or initiatives that we're going to strengthen, whether it's the mobile, whether, we've talked about this issue of going door to door to make sure people are pre-registered, whatever it is, we just have to go ahead and just focus on those zip codes. I know colleagues have discussed this, quite a bit, but I think those slides are very telling of what it is that we have tried to do. And we have closed it, as you said, where we were originally, but we need the state to help us actually, given that we have been, so specific about where they are, and we know and we have that information. We do need that assistance as much as possible. That continues to be a real concern for me. The only other question, not question, but I think that there was an announcement, I believe, that the Hagerstown mass vaccination site now is first come, first serve. Is that right? Do you have any information about that? Okay.
Yes,
yeah,
they did announce that
morning.
Yeah, that yesterday that it would be a first come, first serve. And I think part of what's also driving that is that the utilization numbers have been not the greatest for Salisbury as well as Hagerstown. And certainly we want more people to do it. We do recognize too that, again, by opening up multiple sites, that will, we've heard anecdotal evidence of a good portion of Montgomery County residents driving multiple hours to Salisbury. Now with the site here, that may take some of that traffic away and drop those numbers. Ultimately the goal is we would love to be able to be first come, first serve at all of the sites, again, when there's adequate supply. But certainly if any of those announcements or pronouncements are made, we'll make sure that you all are aware of those.
I appreciate that. And again, I think as that occurs, then hopefully we will find a way to, strengthen the access in those zip codes. I know I saw that the executive, I believe, visited the Hungary Center, which is in District 5. But I think we've all visited that center operation when they were doing the testing and food distribution, et cetera. The good news is that we do have some sites, but we just need to figure out how to get those doses and how to be more strategic so that map can change and we can actually have more people vaccinated in the zip codes where we have had persistently the highest number of cases and the biggest concern. not surprisingly, those are the zip codes where you have a high concentration of our Black residents and Latino residents. And so very important information. I appreciate all of you and continue to look forward to working to support you in any way possible. Thank you.
I would just note that we actually started having conversations yesterday. I was over at the Germantown site and with some of the public health team talking about what would walk-up registration look like at our various sites, just to begin that planning process, because it will change the way you run sites, and I think that's the big thing. And so I think we agree that we want to get to that point once, right now we've got a long pre-registration list of people that we need to get through. We've got at least 34,000 people pre-registered with underlying health conditions before we even get to the general population. And so I think what you'll see is across the state, in areas where there's more hesitancy, you'll get to the open registration faster, particularly at the mass vaccination sites. We obviously have seen where people identify themselves as conservative are some of the more hesitant people. So you would expect in the redder counties, you'd have more hesitancy, and therefore you'd have more, you'd have less people coming to the site. And so we're thinking about it already. We already were looking at for the Germantown site, how would we do this differently if we had to do on-site registration? And so I think that we obviously have people in our pre-registration system we want to get through, but we've heard the message. We've heard the message from the governor that he's going to want to move to more open over the coming weeks. And it's just maybe a few weeks for us, a few less weeks for other places. And so we're getting ready.
No, I really appreciate that. And, there have been some efforts to look at particular models to address the issue of access to vaccines by our communities, our BIPOC communities. And I have studied those models, but of course, it's all dependent on the number of vaccines available. Nonetheless, there are some pretty interesting best practices that I think we have started to put in place. And I hope that we're already working to just kind of activate or expand those as the volume begins to increase. And I absolutely believe that we have to focus a lot of that capacity in those zip codes, immediately, as soon as possible, almost like a triage, which I know you have been doing. But the fact that, the numbers are still what they are, tell us that we just need to continue at that. So look forward again to making sure that we get all of that going. Thank you.
Thank you. Actually, Dr. Gales, could you come back to, I think last time we talked, there was a plan to begin vaccinating our ABS workers, where we've had a whole lot of closures of the stores of the last year. I think that we were beginning today or tomorrow.
This week. Mm-hmm.
This week.
They
Okay.
will be providing an opportunity, as well as other continuity of government employees who've been identified in that on Thursday and Friday. Right. So please stay tuned to your inboxes later today.
All right, we're on track for that. Good to hear. Councilmember Reamer.
Thank you. Thanks to everyone for your work through this crisis. It's unbelievable how long this has been, and yet I was, in talking with family and friends, we're really in this for a long haul. I will be doing boosters shots for vaccinations, presumably, maybe for the next several years. And so these models that we're building and these, lessons that we're learning are going to be really important for a long time. I think I want to just say my general take on where we're at is that the vaccination campaign, broadly speaking, is working, that the variants appear to be taking over, but without the progress that we've made on vaccinations, we would have a much higher surge of cases than we are experiencing. And we seem to be holding at this plateau. Whether that plateau will ratchet up higher, based on the pace of the variants taking over, I guess is that's the question. But for the past several weeks anyway, we've been holding at this plateau, which certainly is higher than we would wish. Fortunately, it's nowhere near the the winter surge. And if we can, fully administer the doses that we believe are coming, which I know we can, and if our residents will continue to be able to get access to the state supply of vaccines, then I'm hopeful that we can outpace the variant takeover. The Hopkins presentation was unclear to me, the variable in the equation of the vaccination. I'm sure they're quite aware of the latest information about the pace of vaccinations. It would have been nice to see that data, but I don't necessarily question it. But again, broadly, I think the vaccinations are working to suppress the virus, but we are, we've got more to do. It seems reasonable to expect the supply of vaccinations by the end of this month. We should be somewhere in the 2/3 to 3/4 of the eligible population having been vaccinated. But in order to get there, I think that's really where it is important what Dr. Gales, you mentioned about the partnerships and the community groups and the touch points, the multiple touch points. It's possible that by the end of the month, the number of county residents who are even able to go to a Germantown site, it's not that they're not able, it's just that we have to take on more effort and responsibility to get right where they live, into their neighborhoods, into their communities, with mobile and other smaller scale clinics and access to neighborhood pharmacies and their doctors. And so if we're able to really get to that granular access, over the course of this month, I'm optimistic that we will continue to outpace the surge of these variants, but who knows? I wanted to ask about, in terms of our equity strategy, it really was unfortunate, to say the least, that the governor blocked our effort to adjust eligibility by zip code. As we know, we have the ability to offer appointments by zip code already. I have been assuming that there are far more people pre-registered who meet our equity goals than we have doses for. And so functionally, we are able to offer as many appointments, no matter what, as we would have been able to offer through the existing model. And now that eligibility has fallen further, there's an even wider population. But could you share with us some information about the appointments that you're offering through pre-registration, through our pre-registration database, and are we still able to get those pre-registrations to our hospital partners? Are there any other partners that are also accepting them? I salute our equity work. I think it has been more successful than most communities. Of course, we have a long way to go, but it has been a priority for us all along. So could you please just talk about, what share, for example, of our 10,000 county doses are ultimately being administered on a weekly basis now in our priority zip codes or along other kinds of key equity markers?
Sure. Thank you, Councilmember River, for the question. I think I'd have to we'd have to look at the numbers to get the exact percentage breakdown of who's going where. But at this point, we're moving quickly. And this is why I want to underscore, we need everybody to pre-register, because we're moving through these lists quickly as the doses become available. Right now, we actually, even last week, we were through those who had, and this is everybody, regardless of the zip code, but everybody who had pre-registered who was over the age of 60. And so we started to move to the next group in terms of 55 and up, and individuals who were 16 to 64 who had medical conditions. And so at this point, I think it's hard to say. We'd have to crunch the numbers to figure out exactly what the breakdown is. But we're to the point now where we're exhausting our list of people who have been registered. And so
That's
again, from a representation standpoint, it's again important that we get everybody into the system and figure out how we alleviate those barriers from people being able to get from their homes to pre-register so that we have their information to go from there. It is exciting that, as more doses come in, that does allow, again, for the opportunity to diversify the different partnerships we have. We trained staff from 6 or 7 different clinics last week to be able to move doses to this week, some of which have already been participating in the program and have had multiple clinics already. We are also excited of the prospect of, again, when there is more of a windfall of doses, that multiple community providers will also have the opportunity to do it. And I would like to add to Councilmember Navarro's question and obvious concern about zip codes. We share that. She mentioned Angari as a site. We have been working to train staff there to be able to stand up and provide doses beginning next week. We've also been in conversations with another clinical entity to stand up an East County option, partnering with one of our religious institutions to be able to do testing there. The contract, I'm not sure of the contract signed, so I don't want to publicly announce that until everything's finalized. In addition, moving one of the, as we transition out of the high schools, one of the new vaccine sites is at Wheaton Rec Center, which is also proximate to those zip codes that you mentioned. So hopefully with those collective efforts, we'll start to see an increase in those numbers. And so that maybe next week or 2 weeks from now, the map will look a little bit different and be a little bit darker in terms of seeing those percentages increase. But I'd be happy to look at that number specifically for your Councilmember Reamer and get it back to you.
That would be really helpful if you could, please. And then am I hearing you correctly? You're saying that we are offering the appointments more broadly at this point because there really aren't enough pre-registrations in our highest zip codes, that those appointments, there aren't enough pre-registrations to use all of our doses or our appointments just in those target zip codes or overwhelmingly in those target zip codes. And so we need a community effort to boost our pre-registrations where we have disparate impacts, and that's the bigger problem, is getting people signed up. Am I hearing that? Is that correct?
So a little bit of both. So yes, we need more people to pre-register. Certainly, we want more people to re-register. But the challenge we had is, as we move through those groups, now it's in a way it's time to reset, because it's going to be open to the broader population, and you'll start to see more of an impact of that equity framework. We were exhausting the list that we had of those previous categories that have been identified as prioritized, including by age as well, and which was, a lot more limited to, as we move forward to 16 to 64 and then to the general population.
I see. Okay. So now
I can give you a real sense of some numbers, and this is real data. So on Friday, we had about 35,000 people with underlying health conditions, 16 to 64 pre-registered. I would estimate we probably have 135,000 of those residents in our county. So we have about 25% of the residents we believe have underlying health conditions have pre-registered. As we have moved in more close connection to the state, we've seen an uptick in the percentage of returns on sending out an invite, getting people pre-registered, getting people registered for an appointment, that is. But with 35,000 people with underlying health conditions, that is probably no more than 2 weeks worth of appointments to offer for all of those residents before we either need more with underlying health conditions or we are forced to move on to the general population. In spite of the fact that we know there are many more people out there with underlying health conditions. I looked at the Kaiser Family Foundation and tried to do some rough math. I think it's probably between 135 and 150,000 people in Montgomery County who are in that age group with underlying conditions that predispose them to COVID risks. And we obviously are not seeing them all in our pre-registration database. And so we know there are more out there, but without their names and information, we have to move on to the next group to continue to offer vaccinations.
Do you know how many the state has in its list?
I don't know. Well, I don't know because obviously there's a little more. Theirs is different because you're selecting your preferred venue more than your. I mean, I think we could probably know like the total number of. We don't know. I mean, we could maybe ask that question to see exactly how many that might be, but
sounds like it might be worthwhile to have a data conversation with the state, and kind of comb through and see where some targeted opportunities may be.
Okay, yeah, that's good suggestion.
Thank you.
Thank you. Councilmember Glass.
Thank you very much, Mr. President, and thank you everybody for the encouraging update regarding at least the vaccination rates, and 20% fully vaccinated and 35% having received at least one dose is good news. And I applaud your efforts and the efforts of your staff to get everybody up and running and to shift with all the changes that the governor has been directing at us, and all the other infrastructure and location changes that we've had here. And I want to just start on that point. I just have two questions, but regarding the sites, I know it's been about 2 weeks since we've last had this public conversation, and there's been some change here. Germantown is now open. Richard Montgomery is closed. Quince Orchard is closed. So can you just share with us an update as to the physical locations where the county HHS is providing vaccination?
Sure. Germantown, Montgomery College, Wheaton Rec Center, White Oak Rec Center, and starting this week, Silver Spring Civic Center. And that's just the county apparatus. We will be supporting, again, multiple clinical entities with providing them doses that will be spread out throughout the county.
Thank you for that. I had seen on social media some people waiting outside yesterday at Silver Spring Civic Building, and I was curious about that, but I'm glad to know that it is already up and running, or will be becoming more functional as time goes on. So thank you for that. And I'm also pleased that all of those locations are central to multimodal transportation options, quite frankly. Going back to the themes that we've been discussing for many, many months, wanting to make sure that as many communities are able to access vaccines, not only the testing, but also the vaccines, and appreciate the collaborative nature of this entire council and the county executive and the Department of Transportation to ensure that Ride-On remains free for the remainder of this fiscal year. And I'll say I hope that it remains free beyond there, as long as people still need testing, recognizing that 78% of the people who rely on our public bus system are people of color, and 47% of them make less than $30,000 a year. So when we are talking about communities of color and lower income residents having access to vaccines, they also need to be able to get to the places where those vaccines are. And so that is why a free ridership program is critically important. So I'm glad that we've opened up those sites, and I applaud the selection of those locations. The other aspect that I just want to touch upon is something that I think, Dr. Gales, that you had discussed early on in your slide presentation. You had talked about the testing rates for those who are still getting COVID testing. And I'm curious what those metrics are like. What are the trend lines for individuals who are continuing, still going to get testing? Because I presume, and I understand the dangers of presumptions, but I presume that as more and more people are getting vaccinated, fewer and fewer are getting tested. And so what does that mean to the data that you're sharing with us for those test positivity rates?
Sorry, I was on mute again. So thank you for your question. So there's a couple challenges. So as you know, we were testing well at mitigation levels throughout most of the pandemic. I still think we're testing at a pretty high clip compared to the rest of the state, but it does create a couple challenges. So what we're finding is that the percentage of folks who are coming in to get tested are more likely to be symptomatic versus before, where we had more open general testing with a higher percentage of potentially those who were asymptomatic coming in. And so that's one thing. We're seeing a higher percentage of folks who are actually have it come in as the test positivity increases. But what's been interesting is that test positivity has held when we've seen as the test numbers have fluctuated. So for example, when we've seen multiple days, Monday and Tuesday, you see smaller cases coming in. The test positivity holding steady, meaning, Saturday and Sunday, you're seeing less people getting tested. But as you go throughout the rest of the week and the numbers rise again, the test positivity actually continues to increase, which suggests that that there's actually more people out there with COVID-19. And as regardless of the test volume, the percentage of folks getting tested who are testing positive is holding the same, whether it's a smaller group versus a larger group. And that's concerning because you just can't write it off and say, well, if you remember in the early stages of the pandemic, that the test positivity is only high because the people who are symptomatic are only getting tested, and it's not including the general public. And so that's something that we have to continue to watch with a note of caution on that. I think part of the other shift too is you're right, there are more people getting vaccinated. So you've got, for example, a lot of your nursing homes and other facilities who are vaccinated now who aren't doing reflexive testing anymore, which it changes the sample size, as well as individuals who may be fully vaccinated and going about who are less likely to get tested now compared to where they were before. So we do expect the sample size not to be quite as large as it was earlier to mid-pandemic, but it does underscore particularly those who are not fully vaccinated and those who have not received any of the doses as well, if they've had concerning exposures and developed any type of symptoms or have been contacted that they may have been exposed, that they get tested as soon as possible.
So you hit on you hit on the question. The main question I had there was about the sample size, and if I understand you correctly, while the sample size might fluctuate, we should not necessarily be too concerned with what the results say, because the extrapolation is that there are just many more people out in the community with COVID, but just not getting tested.
Well, I think it would. Again, we're moving back to a space where we see more people who are symptomatic being more likely to get tested than those who are asymptomatic, and particularly given the space of. So what I'm trying to say is that, yes, we capture the number of people who get tested, but it suggests that there may be a pool of individuals who are asymptomatic based upon all of those other factors who are not getting tested at the rates where we saw earlier, which might be hiding a number of cases out there of folks who are asymptomatic and unknowingly transmitting to other folks.
Very good. Okay. Well, I appreciate the clarification, and something that we'll certainly continue to monitor. So thank you all for this briefing.
Thank you. Councilmember Rice.
Well, thank you very much. And so, Dr. Gales, I just have a couple quick questions. The first one, equity plan from the governor or in MDH? Have we heard anything, seen anything?
No, thank you for your question, Councilmember Rice. We have submitted our equity plan along with all the other health departments. And if you'll allow me to indulge me a second, I just want to be clear with folks at home. So when we were asked to submit an equity plan, I want folks to understand is we had conversations with the state months ago to share with them what we were doing in equity, all of the different jurisdictions across the state. I hope if you've been paying attention along the lines, we've been enforcing an equity plan for months now, since the early stages of vaccine rollout. Some of those steps, in fact, the state has actually emulated in terms of putting forth, whether it's creating prioritization zip codes, as well as creating a pre-registration system for the mass vac sites to give recognition of that. So that has been submitted. From my understanding, actually, I don't know what the state will do with that information and how they will roll it out. It was explained that the Vaccine Equity Task Force that was stood up is the state's effort around equity. We have continued to provide feedback to try to refine that operation to make it more community focused and community based, to build upon those relationships that we've discussed at length so far that we have on the local level.
You know, I just find it interesting, and thank you for that update, Dr. Gales, that now we're seeing a lot of the analysis of the governor's response. And this is akin to what the council president had said. I'll remind us, when this first started, the state invested a lot of money when it came to talking about testing and acquisition of tests, and those tests that the governor, paraded in front of a South Korea Airlines jet, talking about how he had done all this for Maryland. And we later found out, of course, that those tests were incomplete, and it took a very long time for us to even make those come to fruition. I think that a lot of those, and I think that there's an investigation from the state level in terms of what happened with those tests and that huge investment of money, of taxpayer dollars that went into that. And now we see ourselves with an opportunity when it comes to ensuring that our community continues to have the disparities that Councilmember Navarro started off talking about addressed. It's very clear where those areas are. And if it were not for the leadership of Dr. Stoddard, Dr. Gales, Dr. Kroll, when it comes to ensuring that we had a mass vaccination site, and for us continuing to advocate, I don't think that would have happened. That didn't happen by happenstance, by the governor out of the good graces of his own heart, targeting this area. And when you looked at those zip code maps, it is what Councilmember Navarro talked about in her district. And I think part of it is in the council president's district as well. And then in my district, 20874, 20876, right there where the Germantown mass vaccination site will be. So again, I just really hope that we can get away from press conferences and words and get to work. As you heard Councilmember Navarro say, I think that, and I agree with her wholeheartedly, we've got to get into neighborhoods. We've got to start addressing some of the reluctance issues that we know exist. Councilmember Friedson and I represent some of the most conservative areas of the county. And so certainly I've talked to, and I know personally, people who are hesitant to take the vaccine that are more conservative in nature. And so from that perspective, it's not just our communities of color. It's not just our communities of lower socioeconomic status. There are a lot of folks out there who we still need to make sure that we get this vaccine if we are to get a handle on the rise in cases. And so just wanted to thank you, Dr. Stoddard, you, Dr. Gales, Dr. Kroll, Dr. Bridgers, and all of your staff and team for standing it up. You guys have done yeoman's work when it really comes to ensuring that we, as a county, have an equity plan. Although the governor tried to chop our knees out from under us, we're still moving forward and doing a lot of the things that we know need to happen to ensure that we're reaching into our communities who still need that assistance. So to that end, Dr. Gales, I am concerned about the uptick in numbers that you mentioned as a part of your report, and concerned about what that means for our school system. Understanding that we are about to embark on a huge influx of students April 19th, which now includes my daughter. My daughter was not planning on going back, but now based on some conversations with her guidance counselor, with her teachers, we think it's best for her to move forward in that. But my question is do we think that based on the numbers that it is still safe to do so? I know that's on the minds of many parents as we see the continuous uptick, not just in our own county, but in this region. So just wanted to get your thoughts there.
Well, I mean, obviously, it's a major area of concern, and trying to balance that guidance on, best practices from school districts who have been able to reopen at different levels, as well as the reality that we face in terms of community transmission. I think it's probably more impactful to also discuss it in the context of other decisions that are being made in terms of reopening. I know there are a lot of people who are upset and angry that we have not supported, or at least from the health perspective, supported providing guidance to you all to open everything up to the levels of the rest of the state. I think the map that we showed you all of the state in terms of looking at the color-coded map, I think speaks volumes in terms of where we stand right now in terms of having a rate somewhere between 10 and 11 versus other jurisdictions. And it's not to say that anybody is doing anything right or wrong. However, I think it speaks to support the approach that we've taken in terms of having a measured approach in terms of reopening, as well as a measured approach in terms of bringing kids back to school, in terms of making sure that the practices are in place to mitigate transmission as much as possible. So I think you have to look at that all within the spectrum of all of those different perspectives. And I think right now, it is a continued day by day kind of situation. I do think that, again, the tremendous work that MCPS has put in to create provisions and standards to minimize transmission as much as possible, but married with the idea of, our continued restrictions on reopening to minimize community transmission as much as possible, as well as some of those best practices learned from other places have us at a place right now, as we currently stand, in an okay place to be able to do so. Now, certainly if the numbers worsen, and part of the challenge that we have here as a jurisdiction is we're a huge population center, very densely populated in a lot of areas. So cases could spread very quickly here, whereas it could take, a matter of weeks or multiple weeks to spread and increase in other areas. That could happen for us in a short-term period. So I say all that to say that in the short term, I think we're okay right now. We'll continue to monitor that. But I think you all are well aware through the pandemic so far, we try to stay ahead of the trends and anticipate as much as possible so that the guidance we're providing is encouraging active steps to be taken before the numbers get to the point where it is worsened and it's bad, because then we're too late at that point.
Yeah, so I appreciate that. And I agree wholeheartedly that that's exactly what you guys do, which is why I wanted to ask that question, because we are, just 13 days in. So inside of 2 weeks, we'll have those students returning to the classroom. So the more guidance, of course, we'll be watching the numbers and waiting for any communication that you have, because what we don't want to do is what we've seen in other jurisdictions, which is the fits and starts, the sending kids back for a week and then shutting down schools again for a few days. And that isn't conducive, nor is it helpful to those who really need to be in the classroom, who need to be in front of teachers, who need to have that additional support. And so from that standpoint, we look ready to work with you and utilize your guidance. I did just want to ask you, based on what you're seeing with professional sports and them having access to some of the best when it comes to testing as well as treatment guidance from doctors, do you think that this is a sign of a trend in terms of what we are to see and expect here locally? Do you think it's more attributed, and I don't want you to opine on the behavioral aspects of professional athletes, but do you think it's more along those lines? Do you think it's more of the canary in the coal mine? Can you just give us an idea? Because when we see, dozens of players from professional sports teams come down with COVID, and some of those have been linked to COVID variants, it is very concerning and is something where I'm just wondering, is that an indication of what's to come here in the public sector?
Well, that's a great question. I think it's tricky. So one thing I would add to that is Dr. Fauci, I was watching news this morning, mentioned that sports could be driving an increase in cases in younger populations, again, due to variants. Part of the big concern we have about sporting activities, whether we're talking about young people, older folk, is what's happening before you get to the field of play or the court of play. And how likely are you, or what's the likelihood that you're bringing COVID into that setting? Because we know once you're in that setting, whatever type of sport you're playing, you're at increased risk because you're having intimate contact with folks in close proximity, and that increases risk of transmission. Now, part of the challenge with, the NCAA tournament just completed last night, they had very strict guidelines in place in terms of being able to cohort the student athletes, regimented testing, very strict protocols in terms of how they could interact with folks, basically keeping a controlled, bubbled environment. And I know there have been attempts to do that on the professional level. It's challenging here because unless we sequester student athletes to put them in hotels and limit their exposure, we can't control their home environments or their lived environments again, and so all of the different actions we're taking with the different restrictions that are put into place are with the express effort to keep community transmission down, so that whether we're talking about student athletes or students in general, we're decreasing the likelihood that they would be exposed to COVID in their community setting, and decrease the chance that they're going to bring it onto the field of play or into the school building. And so that's why we're providing the guidance that we're providing, because I don't think we'll get to a point where we could create that type of environment for our student athletes. We don't have the resources to sequester them in that way. And so the challenge is, again, is to keep the numbers, much to your question about schools and returning people to school, is drive that number down or keep it as low as possible, so that the likelihood that someone is stepping into those places of having COVID-19 is as low as possible.
Thank you, Mr. President. Thank you, Dr. Gale.
Thank you, Councilmember. Councilmember Jawando.
Thank you. And as always, to the great team, I know we recognized you earlier, Public Health Week. It's really been Public Health Year plus, and really appreciate all the work that you all are doing every day. Couple questions. Totally concur. You know, I think everyone knows this. My colleagues and the health team knows how much of a proponent I've been for us to expand our already robust equity strategy. You know, we attempted a couple weeks ago, as was mentioned, to put another strategy on the table as far as focusing our doses at the health department, again, just the ones that we receive, and opening eligibility in these targeted zip codes to affect that map that we saw earlier. That I'm glad Councilmember Navarro asked you to pull that back up, because we know what's happening. And one of my big concerns, as I think you all share, and I want to ask you comment, has been, even when we open eligibility and we have an amount of doses that's not adequate, and we have a population, a new population coming in to attack and get vaccinated, which we want everyone to be vaccinated, that you have a danger of folks that are in these highly impacted zip codes and communities being lost in the shuffle. And that's why we have to have the equity approach that we've put forward. So I guess a couple of questions. You know, I would like to know if you share that concern, which I have, but to me, it's directly connected to. So if you could just restate, how many doses did we receive last week, and are we receiving this week, and are we receiving next week? And I know you may know one or more of those, or not all those answers, because we're hearing about this large influx that's to come, but what do we know as far as what we're receiving?
Thank you, Councilmember Jawando, for your questions. And so we've actually would like to thank the state for increasing the allocation that we received at the health department. It's gone from 4,500 to 6,600 to 8,600 to 10,730 last week. And we've been told to expect that amount at least for the next 3 weeks on a weekly basis. And again, the majority of those doses now have shifted to Pfizer doses, with an allotment of 200 Johnson & Johnson doses. So we're appreciative of the state recognizing our efforts to get doses out, and have increased those doses. Now, I think there's still some discussion about how many doses will go to the site at Germantown once it's a state mass vac site.
Right.
And due to the efforts of the team and working with the state, I believe there's somewhere approximately 25% of those doses will be earmarked for Montgomery County residents. So that's where the numbers stand. I would like to actually go back to one of your initial points that you made about coming up with additional strategies. We did discuss that at length here. And I would like to say that in the letter that the health officer sent to the deputy secretary at MDH requesting an equity strategy, we did or throw that out there as an idea for the state to look at some alternative strategies to give additional consideration to jurisdictions to be able to make those determinations if there were some factors, demographic factors or other factors that jumped out as increased risk factors. We did not receive a response on that. Now, I believe Vermont and Montana have actually passed state level decisions related to equity to give preference. I know Vermont's actually is giving additional but giving additional consideration for race as a factor for vaccine eligibility. So maybe, as part of the state's response to that letter we sent a couple of weeks ago, that is something that they will consider doing.
Yeah. Well, if I could just pause you there, we did receive a response. It was no, in that we were, maybe not directly, but indirectly, we're told that we couldn't move forward with the strategy. But I'm hopeful that you're right. There are a lot of other jurisdictions that have done this and specifically targeted. I think some places they've removed any age eligibility in certain highly impacted zip codes because we're seeing, which is one of my next questions, younger people in communities of color. So you kind of have the double whammy in some places that are where you're getting increased cases. So, but go ahead and continue. I'm sorry, I cut you off.
That was it. I was just going to make sure that folks knew that there were other states and other jurisdictions who have taken those actions, but you are correct. We were told we have to follow what the state is doing.
Yeah. Well, I think it's something worth following up on because I think we want to give you all maximum flexibility to react and implement a strategy with the doses that we get. And we are thankful to the state. I'm glad we're at over 10,000, but those are the doses, because there's a lot of other entry points. You have the mass vac sites, you have the pharmacies and everywhere where people can get and are getting the vaccine. We should be the most targeted and most focused on the equity strategy. And so I'm hopeful we can renew some in light of action that's happened across the country when we get the influx that we can really target and amplify what you all are doing. I guess the last question I had, I appreciate Councilmember Rice's questions about the school. I am concerned about that, in particular, in the light that we're seeing. Are we seeing the same increase in younger people go up? I know you talked about that a little bit. Are we seeing that? Is it delayed? I know we're seeing it in other places. That's a concern. I know some of it's related to youth sports and extracurricular activities, but obviously school reopening could have an impact on that as well.
I think I confess I have to take a close look at it. I think our numbers match or consistent with others. We are seeing a shift to younger cases, younger groups making up the majority of our cases, since we do have such a significant percentage of our older groups covered now with the vaccine.
Okay. And then I guess the last thing I'll say just is a shout out. I've gotten so many thank yous from some of our faith partners that have stepped online and other community partners who are now helping deliver the vaccine in really hard hit communities. I'm really hopeful that with more doses, we can continue those kind of micro targeting strategies and delivery methods. So big thank you for all your work there. Thank you, Mr. President.
Thank you. Councilmember Albornoz.
If I may, I have an answer to Councilmember Jawando's. I was going to show the slide that I think shows our age breakdowns real quick.
Great.
If I'm going to share my screen real quick so I think it's a good illustration. This graph shows the percentage of cases by age across months, and then you can see the question you asked was around our young people. You can see that as the orange marked line for the 10 to 19 population. You can see that they are a higher percentage of our cases over the last month. I think in part that's being driven by a reduction. So this is a percentage of cases, right? So if you're vaccinating the older population, you would expect, as you do see at the bottom solid yellow and green bars, they're going down while the younger population is going up, because obviously you're vaccinating the older people, and therefore the younger people who are unchanged because they can't be vaccinated in large part are going up. And so if you look at the three increasing, or the ages 20 to 29, 10 to 19, and 0 to 9 have all slightly increased over the recent weeks and months. But I think this is the data you were asking for. And
yeah, thank you. That's helpful.
Yep.
And actually, I'm sorry, I just wanted to make one last comment. We tend to lag, you can pull that down, the European increase about 3-4 weeks. And I know that people are concerned that, as the variant takes over, I just would ask that we continue. And I think we have hold strong on our restrictions in place so that we can get through this time, get schools reopened. And, hopefully we don't see what's happening in Europe and certain parts of Europe with these large increases in cases and hospitalizations. So I'm hopeful we can stay where we are for now, and realizing it's difficult, but we're getting there. Thank you.
Thank you. Council Vice President Albornoz.
Thanks. So we've covered a lot of bases, sports pun intended. Today, the Nationals are officially opening their season, ironically delayed by 5 days because of COVID. But really appreciate the questions and comments from my colleagues. And just first a moment of reflection, then a comment, and then a couple of questions. The moment of reflection is just how far we've come. While obviously we're all very concerned about the variants, we're all very concerned about this most recent spike and have to treat it seriously, have to make sure that we continue to do everything humanly possible to contain this virus. Just from where we started to where we have landed is truly remarkable. I pre-registered as soon as I was able to here locally, and I got an email back right away with 6 different languages offered, and just the level of response, the dashboards, it really is remarkable the progress we've made in so many areas. And so it is appropriate that we're acknowledging Public Health Week and this really, truly remarkable team, which I continue to really appreciate. And obviously all of us saw what's going on in Texas with the 40,000 people attending a Rangers game, and the spring break images from Florida and other places, which is extraordinarily alarming. And it's I think all of us need to be proud that we live in a community, in a region that has continued to take this as seriously as we have. And although the numbers have spiked, they have not spiked anywhere near they have in other parts of the country, which I think is important to acknowledge as well. I did have a couple of questions. So I know that when residents pre-register or register through the state or through the county, they have the opportunity to check a box if they need access to transportation. Do we know what percentage of the folks are that are signing up to pre-register are marking that box? And do we have any updates on what the progress is on folks seeking transportation assistance? Are we able to accommodate that so far? How's that going?
I believe the last data we had for either needing a transportation to a site or being homebound combined, I think was 6 to 7% of the people pre-registering check that box. And obviously the ones who need transportation, we're connecting with a Connect a Ride program or other opportunities to get them to sites. And what ends up happening, so the Food Access Call Center actually, interestingly, is doing a lot of those callbacks to people who identify as needing transportation. And we're arranging transportation. In most cases, they identify, the individual helps identify a resource that's perfect. Oh, my brother could take me, that's fine. And something along those lines. And so I think many of those get worked out that way. And we provide a connection to a ride service and obviously it's free to those who can't find another source. Now for in-home, I think Dr. Gales could talk more about that, the homebound residents. As I recall from his update late last week, we were down to approximately 70 individuals who still needed some vaccination at home. And so we have been able to, through various partnerships, serve many of those residents, but I'll defer to Dr. Gales to make sure those numbers are correct.
The number actually was 40 in the low 40s, and I unfortunately don't have an update on that, but we can certainly get that information to you. Again, it underscores for those who do meet those needs when they do pre-register, please make sure to make those donations so that we can make sure that you get the resources needed to get vaccinated.
And just to add, Dr. Gale, the number was 45, and we continue to work with our Aging and Disability Services to identify those independent living spaces where we're targeting homebound individuals and their families now. So that's part of our targeting strategy with our homebound individuals and those individuals in those complexes.
Appreciate that. I've asked this question before, but I think in light of what I said earlier with the other states moving so unreasonably aggressively towards reopening, with Texas and Florida being just the outliers for sure, probably others as well, but them in particular. I know the governor obviously eliminated the requirement to quarantine when you're coming from other locations with higher incidences of spread. and it's not something that we can really police in any reasonable fashion. But do you think, Dr. Gales, that it would be reasonable for us to consider making some sort of a comment or a disclaimer, particularly folks who are traveling to these areas that do seem to just be radically going in a different direction than our community has in terms of containing the spread?
Councilmember, I would also think that is important. And this is, forgive me for an editorial comment, given that the governor has said that the majority of cases are due to travel, I do find it surprising that we don't have a policy to address that. In terms of having quarantine, if travel is apparently the source of the increase, where is the subsequent action to address that? So as you're right, it is very difficult to police and to monitor, but we should be, continuing to provide that guidance to folks that, again, if they are traveling, if they aren't vaccinated, quite frankly, regardless of where they're going, if they're traveling and they're not vaccinated, the risk of coming into contact with these variant strains is higher than at earlier stages in the pandemic. And so we would certainly recommend that they do follow the guidance of limiting their exposure to others, making sure they get tested and get their results within a time frame before they go back to moving about within our respective communities.
I would also add, CDC did update their air travel recommendations, saying if you are vaccinated, you can do some essential travel, but they did not encourage non-essential travel. I will say, though, there was a report, I believe over the weekend, or maybe it was even yesterday, that looked at air travel even out of, I think they were actually at Reagan, is one of those sites they visited. And what they said is that, air travel's up to about 2/3 of its capacity relative to where it was pre-COVID. And in fact, I think one of the airlines, I believe it was Delta, had to stop its policy of leaving the middle seat open because they had so many people who were trying to fly. And obviously, having a lot of people trying to fly is one thing. Having to now put them in closer proximity to one another to accommodate that is increasingly troubling. And so, obviously we encourage people to be tested. Certainly, getting vaccinated before you travel is probably the best idea, particularly now that we're going to, move to this eligibility, broadening eligibility. But obviously it's definitely a concern because we've got all the variants here in Maryland, but you can have additional introductions that happen by virtue of travel and bringing it back, and that's how you help really escalate the spread.
I appreciate that. I'll close with sort of an observation. As we celebrate Public Health Week, there are a lot of contributing factors in addition to the virus that negatively contribute to public health. I was really taken aback recently. I saw two recent presentations, one about the evictions that are looming, and then also one about the zip codes that have been the most disproportionately impacted by job loss through the economic recovery. And not surprisingly, they almost exactly correspond to the 10 zip codes that have been most impacted by the virus. And I just want to acknowledge, Dr. Gales, you have been telling all of us that we need to start thinking about a post-pandemic environment. And obviously, we're correctly focusing so much time and energy on the immediate crisis before us, because it is a crisis. But we'll need to continue to lay the groundwork to help with recovery in all aspects, not just with relation to the virus, because that does have a clear and direct public health impact post-virus as well. So, and it's because of your leadership and that of HHS and this entire team that we're, I think, better positioned than most other jurisdictions in helping to meet this moment. So thank you all again for your leadership. I defer back to you, Mr. Council President.
Thank you, Council Vice President. Councilmember Katz.
Thank you very much, Mr. President. And I was thinking this morning when the Vice President declared Public Health Week and everyone was on. I think we've had Public Health Week for probably Public Health Year, and we'll be continuing to have Public Health Year for quite some time to come. It was always important to all of us. It was something we took for granted rather than paid attention to each and every several times a week. And so, again, we thank everyone for what they're doing. I have had a text from someone that said that we we've said several times that we're looking at Pfizer and we're looking at Johnson & Johnson for the Germantown site, but anyone that has received Moderna prior to this, and obviously they're supposed to get the same grouping from when they go back for their second dose, of which I happen to be one of those people. Will they be able to get their Moderna? How is that working?
Yeah, thank you, Councilmember Katz. Yes, so whatever dose you receive first will be the dose that you get second, the state. So when we're talking about Pfizer and Johnson & Johnson, and I'll make sure to clarify this moving forward, is that we're talking about the first doses that we're receiving. So the second doses that we receive on a weekly basis, we get based upon what, who got what a month ago. So if you did receive a Moderna vaccine as a first dose at those previous sites, you will be able to get a second dose Moderna vaccine at any of the sites that are available when you make your second appointment.
Right. And in fact, when I know firsthand, when I did it this week, I was told that, that Friday I could get my second dose. It asked what I got for my first dose. So, but I did want to be clear for people that they shouldn't be concerned. The doses will be available in the Germantown site. So thank you for that. And then the only other one that I have is that I think it was Dr. Stoddard that mentioned this about the listings, the pre-registered listings that we have, and how many thousands are on the pre-registered listing. Do you know percentage-wise, by the time it actually someone is, after they pre-registered and are told that they could get an appointment, do you know percentage-wise how many people say that don't get the appointment because they've already gotten the vaccination somewhere else through other means?
Yeah, so previously it used to be, when we were actually staying behind the state, it was about 20% because there were so many other opportunities that they already had through other opportunities. But as we've come closer or in line with the state, it's been about 50%. So 50% so we will send out basically twice as many offers of appointments to fill the slots as we need. So if we have 10,000 opportunities this week, it'll probably take 20,000 people on the list to fill those slots. Recognizing that some portion of that 50% that don't respond will just miss it, or they will be vaccinated through some other place. So it's hard to say exactly what their ratio is of got it through another location, deciding you want to get it, or just missed the email. But it's about 50% in recent weeks.
Well, and the question became, if someone said, well, you have 35,000 sites and you're getting 10,000, does that mean I have to wait 3 weeks? And in reality, they might not have to wait 3 weeks because by the percentage. And of course, I've had people yesterday, a person mentioned to me that they actually went to Cumberland to get a site, the vaccination. So I know that people from Montgomery County are going everywhere to get it. And that's unfortunate that we had to do that, but it's also fortunate that so many people have received it. So with that, thank you all once again for everything that you're doing. And thank you, Mr. President.
Thank you, Councilmember. Councilmember Friedson.
Thank you. First of all, I just want to add to the chorus of appreciation for Public Health Week, also known as Public Health Year. And just wanted to express my appreciation to each of you and to your teams, because there's a lot of people who don't join us for these calls who are doing a tremendous amount of work every day. I've been working around the clock and just want to express appreciation for that. And also gratitude for the fact that we live in a place like Montgomery County that is basically the center of the world of public health and has some of the hardest working and most talented people on the planet when it comes to dedicating lives and talent to the betterment of public health. And never was it more clear how much our health is reliant on everybody else's health, which is the basis of public health, which is different from healthcare, which is each of our ability to keep ourselves healthy. Public health is the idea that our health is dependent on others, and never has that become more apparent on our day-to-day lives than it has been over the past year, something that you all have dedicated yourselves to your entire lives, but has become increasingly clear for each of us as part of our daily lives. So I just wanted to thank you for that. Quick question in terms of, I just heard the double the number of folks needed to fill the number of vaccine appointments. So if you have 10,000, give or take, you need 20,000. Do we have a sense of the number of no-shows that are coming to county sites now? And is that similar to what it has been before? Is that starting to change? I mean, as we enter into different categories like essential workers, where we're going through employers and other things where people aren't individually necessarily setting up their own appointment, I'm just curious if that has impacted it and whether or not, there's a way to address that at the county sites in particular.
Thank you, Councilmember Friesen, for the question. I don't know offhand. Part of, I guess, we try to triage the no-shows before they get here, if you will. So, for example, if I'm sending you a link and you've already, you've already used it, or you've already been vaccinated, or you choose not to, we try to just keep moving through the list. And so we try to look through each day to see what percentage of those appointments are being filled later on in the week. And if, that number continues to be low, we just continue to churn out invitations. Again, trying not to wait too long for someone to, to just kind of sit on an appointment before we offer it to someone else to make sure it's filled. But today, I know all of our clinics today, and Dr. Bridges is on, I believe all of our clinics today, all of the appointment slots are filled across the 4 different sites.
That's correct.
Appreciate that. I'm wondering whether or not we're going to see more folks not show up, as a greater proportion of those who most wanted were most motivated, as we get into the next categories where there already are some lingering uncertainty and concern, whether that goes up. So if you could just keep us abreast of what those numbers look like, not just in the filling of existing appointments, but in the show up rates, so to speak, of the appointments that are filled, of what the no-show rate is each day. I just think it's something that we ought to continue to monitor as we enter this next phase of vaccination, particularly next week, as more eligibility opens up based on the state's situation. I think that would be helpful. And one other thing I wanted to note, I've received some correspondence from blind and visually impaired constituents that there were some challenges with their ability to access the vaccine appointments, that the instructions came separately and that caused some challenge. Somebody was helping them to access the appointment, and the separation between the instructions that went alongside the vaccine appointment request made that difficult. And I'd be happy to follow up with you, but if that's just something that you could look into as we talk about ensuring access to those in our community, we want to make sure that everybody has access. So and I know there's a lot of folks that you have to focus on, but if you could make a special point of taking a look at how that process works for those who have visual impairments or blindness, that would be appreciated.
Yeah, I saw that outreach, Councilmember Friesen, and I immediately shared it with our IT team to make sure that both the notifications that they received as well as the website were prepared with screen reader or accessible. In addition, I want to make sure that residents do know that they can also call for the pre-registration number. It's 240-777-2982 and receive direct support assistance that way too. But again, the site should work for that. I sent that along to the team to make sure that they make whatever required changes they need to make in both the notification email process that you described, as well as the website, to make sure it's working for that as well.
Appreciate that. Thank you for being on top of it. It's very important. So I appreciate that. Last question. In terms of, you had talked about before of herd immunity, that we're far away from that. Based on what you shared, I wasn't quite able to decipher, besides the fact that we're not quite near that point, but do we have a sense of at what point we would be close to, I mean, as we're now heading to broad access to all age groups and hopefully large increases in vaccine availability and appointments, at what point do we think that we would be, in a place that you would be more comfortable that we're kind of getting ahead of the variant, so to speak, as we were discussing earlier?
Well, from an epi standpoint, I'd love to see vaccination rates over 80%, which we still have a ways to go before we get there. And the time frame to predict when we get to that point is a little complicated because, again, it's dependent upon the doses that we get in order to achieve that. I think, at least for me, that is the type of level we need to see to begin to have that conversation about herd immunity. And given that, there's a lot of, to the earlier question, there's so much travel and movement around, it's not important just for us as a jurisdiction to achieve that. It's also important for the region to achieve that as well. Again, hopeful that we'll get a windfall of doses very soon to be able to see that increase significantly in the percentage of folks who received at least one dose, as well as the percentage of those who've been vaccinated.
I would also, Dr. Gales is absolutely correct. I think 80% is probably a good number. I will note that it's a complicated math question too, and depending on the variants that take over, the R naught of the variant, it will affect the number that it ultimately needs to be from the vaccination perspective. 80% is, I think, probably it's a really good target, and I think it's probably a good baseline to go from. But if a more dangerous variant takes over, it could end up needing to be 85%. If a less dangerous or less permissible variant takes over, it could need to be 75%. I think that's the tricky part about this, is that the dynamics of the virus's ability to spread directly impact the vaccination rate needed to reach herd immunity from a epi standpoint.
And is that 80% of adults? Is that 80% of 12 and over? Because I know that's what the current phase is, that 80% of the entire population, which would include those who aren't eligible to be vaccinated.
Well, I think, again, it's complicated numbers and not a simplistic formula, but obviously as many people as possible, particularly given if we find that the variant strains continue to infect younger folks as the rates that we are concerned about. Again, because even though younger folks may not be experiencing severe symptoms as others, they can still be effective transmitters and carriers of the virus that could infect others who aren't vaccinated.
Appreciate it. Thank you, Mr. President, and thank you to each of you.
Thank you all. I don't see any other requests to speak, so let me thank you all for all your hard work. Congratulate you again on Public Health Week, and keep up the great work and let us know what you need.